Okay, so this is clinical placement 2. We're going to talk you through the formative feedback sheet that you can be using in your bipartite. Now, just like all the other videos, you're going to see two colours of writing here. There's going to be green, which is going to indicate feedback and signposting for your students, and blue is going to be the types of evidence that you might be expecting your students to bring along in that portfolio. Now, one of the things I think that sometimes happen with clinical placement too is that it's quite a portfolio heavy assessment, particularly around understanding contrast media, understanding all of the different drugs, etc., etc. So it's quite a challenge for the mentor, this particular placement. In that it's not about observation per se, it's about sort of demonstrating knowledge. So if we start off with feedback and signposting then, so here is the first learning outcome for the module is demonstrate a detailed knowledge of anatomy, cross-sectional anatomy, pathology, to encompass all of the different particular examinations that the student will be undertaking in this particular clinical placement. Now, if you look back to the competencies, which we'll do here, remember that I always advocate having the competency statements with you whenever you undertake a bipartite. What you'll see under that first one of knowledge and understanding there are the 4 particular specific points of competence. So here we've got demonstration of detailed anatomical knowledge of the related systems examined, detailed knowledge of physiology, reviewing of cross-sectional images of the neck, thorax, abdomen and pelvis, and this is essentially around anatomy, and also detailed knowledge of how pathologies manifest themselves on the images. So moving back to the formative feedback sheet, you can imagine the sorts of things that it might be worthwhile discussing with your students. So remember that the second clinical placement, I'll just write these on in black just for a moment here, that the second clinical placement is around sort of axial imaging, it's around contrast examinations, and of course it's around it's stated as cross-sectional, but the reality is that it's CT anatomy. Okay. So that kind of is really self-explanatory then, isn't it? So you're looking at students' axial radiographic knowledge, so more sort of traditional projection radiography really. But you have to remember as well that this will also feed in to the CT anatomy as well. So for example, there may be a question for them on their OSCE around C-spines. So any axial anatomical knowledge will obviously be transferable over between projection radiography and CT anatomy as well. If we start with the blue, I think we'll start with the types of evidence. So what types of evidence are you going to be wanting from your students? So as with all competencies, discussions are always a good place to begin, sort of discussions with your students. You can review images with them. Okay, so these can be anything from, like I say, projection radiography. If you still do kind of barium imaging, those sorts of things, that's fine. You could even look at CT colonographies, looking at the effects of negative contrast media. The students are also given anatomy worksheets as part of the module, so their completion of those anatomy worksheets will obviously be providing evidence for the meeting of this particular competence. Okay. Now then, so some of the signposting that you might want to direct your students towards. Sites such as Radiopedia can be quite useful, particularly there for pathology. Okay. So other sources of kind of potential information around this particular competence, as well as kind of, I mean, Radiopedia really, it's about internet resources. Other kind of signposting things, I mean, other things they can do is things like, sitting in with radiologists or reporting radiographers even. Or, if you've got a hospital library, any kind of, anatomy textbooks or whatever. I mean, this is fairly straightforward really for the student. They shouldn't really have any trouble getting hold of any resources, because there'll also be, plenty of things on Blackboard for them as well. So moving on to the next learning outcome. This one's a little bit trickier. So this is around critically reviewing the range of positive and negative contrast media. So again, if we move back towards the competencies, okay, and here we are. You can see here we've got things around justifying the indications and contraindications for contrast media, the effect that it has on the body, the nephrotoxicity, acute kidney injury, that sorts of things, any of the neurotoxic effects as well, and also the administration requirements for contrast media. Okay, so those are your three, as I say, those are your three main competencies for that particular learning outcome. So again, if we go back down now towards the formative feedback sheet, okay, so we'll start off again, I think in blue. So here we're going to be talking about the types of evidence that the student will be able to give you for evidence in those particular competencies. Once again, discussions are of course very good, but we also want our student to give us a variety of evidence. So they could do things like reviewing local protocols, we could also look at the patient information that often accompanies contrast media. Any discussion of literature, I mean, there is an absolute ton of literature out there around the use of, particularly around the, indications and contraindications of contrast media and its different physiological effects. I mean, although we tend to focus on the kind of nephrotoxic effects of contrast, there are of course other types of effects. Production of free radicals leading to DNA. Strand breaks has been implicated as well with the use of contrast media. And around the calculation of dose, I mean, you can give them your own calculations to do if you want to. So something around maybe pediatric administration and those sorts of things. So there's the types of feedback that you would like from your students. And what we'll focus on now is, of course, any sorts of signposting that you can give to your students. Obviously, if you're getting them to review in local protocols, your own protocols are also useful for them to signpost them to. Any sort of SOPs that you've got for the administration of contrast media would obviously be helpful to the students. Other things that you can think about, perhaps, I mean, they'll all have this on their reading lists, but you know, the guide to radiological procedures is obviously a good source of reference for them. Is obviously a good source of information for them, particularly around the calculation of quantities and the administration of contrast media.